This is Dr. Michael Cameron, and this is the Registered Behavior Technician module number 9. The specific strand that this module is connected to is the Registered Behavior Technician task list item B03, which is for assessment. And just a reminder, this training program is based on the Registered Behavior Technician task list, and it's designed to meet the 40-hour training requirement for the Registered Behavior Technician credential. And the program is offered independent of the Behavior Analyst Certification Board. The title of this particular presentation is Assist with Individualized Assessment Procedures. The duration, similar to other modules, is 60 minutes, and of course it'll be a competency-based quiz at the end, and that will consist of 5 questions. With respect to demonstration recommendations at the end of this module, I suggest that you ask your BCBA supervisor about the assessment tools that they specifically use to assess individuals. And the answer to that question will be varied. It'll depend on the age of the individual that your BCBA supervisor works with, the developmental level of the people that they work with, and also what they happen to focus on as a BCBA. Some of them may focus on early intensive behavioral intervention, others may focus on social skill development, still others may be more comprehensive in their work. So for that reason, these individuals will have different assessment tools that they routinely use. And if you happen to be in a school-based setting, for example, if you work with a school psychologist or a speech and language pathologist or an occupational therapist, a physical therapist, those people will also have their specific assessment tools that they use. So it's always a good idea to familiarize yourself with the assessment tools, to ask the question, what assessment tools that they use, and to ask for a bit of a review of those assessments. It'll be important for you as a registered behavior technician to have familiarity with the different possibilities in terms of assessment. Regarding the need for rehearsal, it's suggested that you practice conducting an assessment under the supervision of your board certified behavior analyst, and only with that person's permission. But actually doing assessment in the presence of an individual, it's much different from practicing and rehearsing. And you will want to gain some personal fluency in terms of doing assessment before actually sitting down and trying to conduct one. So I do recommend that you rehearse. And then finally, once rehearsed, you'll demonstrate your ability to use an actual assessment tool. So those are my recommendations regarding demonstration of skills. Regarding the specific goals of this module, there's 5. And the first is for me to describe the best practices for designing and delivering services. The second goal is to describe different types of assessments. There's 3 that I'm going to focus on in this module. The first one is what's referred to as norm referenced. The second is criterion referenced. And the third is curriculum measurement. And I'll be describing all 3 in the context of this module. My third goal is to discuss the concept of balanced measurement and individualized programming. And by balanced measurement, I mean that we really need to be evaluating and assessing all those things that matter in the individual's life and that will make a difference in terms of their quality of life. So that is something that we'll be discussing in the context of this module. The fourth goal is to discuss the role of the registered behavior technician, that's you, during the process of assessment, and you will play a very important role in the entire process. And then finally, the 5th goal is to discuss the importance of progress monitoring and progress verification as well. So those are our 5 goals for module number 9, Registered Behavior Technician Task List Item B03. Now I'll give you a brief introduction to assessment, and then after that I will go into to greater detail in terms of the assessment process. Just by way of introduction, assessment occurs in a cyclical fashion. It is dynamic. It is never-ending. We are evaluating and assessing all the time. But there are 3 specific steps in terms of the assessment process. The very first step is that we go about this process of implementing the assessment and gathering data. What data? The person's responses, how the person performs during the context of the assessment. That is the very first phase. As a result of that, we then receive a generated report. And that report will be produced by the behavior analyst that conducted the assessment, or if it's somebody from another professional category, such as speech and language pathology or occupational therapy, that person will report the results. Now, one of the things that you should expect from another professional, if they're presenting to stakeholders or around the table, meaning the mom or the dad, other people from other disciplines, then they are presenting their assessment results in plain English. They are speaking in understandable terms. They are speaking clearly. They are framing information in such a way that the information is digestible and understandable to everyone sitting around the table. And that'll be a goal for you as well as a registered behavior technician. Whenever you're speaking to a family or speaking to other individuals, you will avoid jargon. You will avoid overly complicated descriptions, and you'll speak in plain English in terms of your findings and your results. You should use that as a rule in terms of your own personal presentation, and you should have it as an expectation in terms of listening to other professionals. The best professionals that I've come in contact with, some amazing people in my life, brilliant people in my life that I've come in contact with. They have this ability to explain things, results in plain English. And we always appreciate that. For any of you here as a registered behavior technician that have been to a physician, for example, perhaps you have a loved one that is quite ill. And perhaps there's a diagnosis that can be fairly complicated in nature. We always appreciate that doc, that physician that explains things in plain English, that they don't default or resort to jargon or overly complicated explanations and descriptions. They have the sensitivity to speak to us plainly and in very understandable terms. So I know I put a lot of emphasis on this, and I need to, because it should be something that you hold dear to your heart in terms of your communication with other people, and it's something that you should also have as an expectation in terms of listening to other professionals when they present. It should be in plain English, and that's an expectation that we have. This also connects to the earlier modules we've had and we've reviewed in ethics. We talked extensively about communication with stakeholders, and one of the things that we need to do to ensure that we have clarity in our communication is to speak in plain English to individuals that care about the person that we're supporting, that care about the person that we're delivering services to. So that's a cycle. We gather information, we report the results of the assessment that we conducted, then we go about this process of planning. So we got the good information, we got the results, now we can move into this planning phase. We can actually design our interventions at this point because we have the road sign and the arrows pointing to where we need to go. So it allows us to plan. Now, just some points in terms of a good assessment. The first thing that a good assessment will do is that it will serve as a baseline for us. That means that it'll tell us where we are at any given point in time. And then the other thing that you should note is that people are dynamic. They are changing. They are ever changing. And as a result of that, we're constantly reevaluating and trying to make a determination as to where they are at any point in their development and where we need to bring them and where we need to go with respect to their skill development. So a good assessment will function as a baseline for us. A good assessment will also give us direction. Once again, I said it already, it serves as a road sign, a big arrow. It's pointing where we need to go in terms of direction with the individual that we're supporting. It'll tell us exactly what skills are intact, what strengths the individual has, but also what the person's deficit areas are. And that's the road sign. If we see a deficit area and that's an area that matters, and that if we develop that skill or that ability, the person's quality of life will improve, well, that's what we need to focus on as a result of our assessment. So it serves as a baseline, it gives us direction, and then it also serves as a framework for curriculum planning. So our entire curriculum in terms of where we plan on bringing the person, kind of our roadmap, our blueprint is going to be informed by good assessment. And then finally, a good assessment tool will serve as an outcome measure for us. So because we have the ability to evaluate and then reevaluate, to assess and then reassess, we can use that assessment as a tool for looking at progress, because there'll be differences. If we've done our job well as a board certified behavior analyst or a registered behavior technician or any other professional, then from one assessment to the next, we'll see improvements. So it serves as an outcome measure for us as well. Now, with respect to the assessment tool that the clinical board certified behavior analyst that you're working with will actually use, that will vary from one person to the next. And clinicians will select the appropriate assessment tool based on several factors. The first is the reason that the person was referred for services. So for example, if the person is a young child, let's say 21 months old, let's say that individual has a diagnosis of autism spectrum disorder, then maybe that person is being referred for services because somebody wants early intensive behavioral intervention. If that's the reason the person's referred, then that's going to bring us in a very specific direction regarding the assessment tool that we use. Now let's take something different. Let's say the individual referred is 17 years old. Let's say that person's presentation is one where the individual has an anxiety disorder. Perhaps they have obsessive compulsive disorder, OCD. And let's say the person has some severe deficits in the area of social behavior. So the reason that that person's referred, the 17-year-old, is different from the reason that young child was referred. So therefore, we will use a different assessment tool for that person. So the reason the person's referred is certainly going to inform us in terms of which assessment tool to use. Now, the next reason we select specific assessments is because of the age and the developmental level of the individual. So what we end up using for somebody that is 21 months old is going to be different from the 17-year-old, 18-year-old. And even if that older person happens to not be functioning at the level of the chronological age, but functioning at a lower level, that will inform us as well in terms of which assessment tool to use. So both age and developmental level will have implications in terms of what we select. And then finally, the funding source. What do I mean by that? Well, the people that fund services, typically insurance companies, or it could be a school system, or it could be a family, it could be a private pay arrangement in a situation. The funding source will often have their own recommendations. So the insurance company will have their own recommendation in terms of the assessment tool that they want to see you use. Or the school system may have their own recommendation in terms of what assessment tool that they want to see you use. Or sometimes families coming into a private pay situation will have a very specific recommendation in terms of the assessment tool they would like to see you use. So here are the reasons we select assessments. The reason for the person being referred, the age and the developmental level of that individual, and the recommendations from the funding source. Now, a board-certified behavior analyst will likely maintain an entire matrix of possibility that they can resort to in terms of assessment. I'm going to show you one of my own that I use, and I'm going to explain it to you briefly, but I just want to give you a really good understanding of how decisions are made in terms of assessment. What you're viewing here is my own copy of my assessment matrix, and what you'll see on the top row is the type of assessment that falls into the category below, and this is for developmental and skills assessments. And over on the left-hand side here, in the left column, we got the name of the assessment, the publisher, the assessment areas, the reasons that I would use it, what chronological age it's appropriate for. I also have notations in terms of some of the limitations of the assessment tool. Now, let's look at the first one. This is the ABLS, and it's an assessment of basic language and learning skills. The publisher is Partington Behavior Analysts, and this is an assessment tool that evaluates 25 skill areas. And the kind of assessment it is, it's curriculum based, and it measures cognition, communication, social behavior, play behavior, motor skills, adaptive skills, and it's appropriate for individuals that are typically 4 to 6 years old. And I have no limitations noted here regarding this particular assessment tool. And it's a curriculum-based assessment and looking at assessment type and criterion reference. And I'll explain those terms in the context of the module as well. Other possibilities in terms of developmental and skills assessment, of course, the VB map. I could also use on the left here the Hawaii Early Learning Profile, and that assessment area will cover cognition, language, social emotional behavior. And the reasons I would use that is to evaluate cognition, receptive language skills, expressive language skills. The HELP, Hawaii Early Learning Profile, is used for individuals from 0 to 3 years old. And there's also another version for individuals from 3 to 6 years old. So you get the idea here. Based on the age of the individual, the developmental level, the reason that they're being referred, I'm going to access one of the assessment tools on my matrix here. Now, the example that I gave you involved comparing, for example, a young child to a 17-year-old that has social skill deficits. Now, notice up here that this assessment category is for social skills, and here are my options. I've got the MGW, Dynamic Assessment Protocol, or I got the Social Responsiveness Scale, or the Social Skills Improvement Skill System Rating Scale. And notice down here that these assessments are for varying age groups. The MGW, for example, is for children and adolescents 8 years and older, and it's designed for higher functioning individuals. Now you can compare that to the Social Responsiveness Scale, which is for individuals between 2.5 and 18 years. And the Social Skills Improvement System Rating Scale is for individuals from 3 to 18 years old. So once again, the assessment that I select will be based on age, based on what I'm trying to measure, and based on funding source recommendations as well. If I'm looking at adaptive skills of an individual, then maybe I'll use the Assessment of Functional Living Skills by Partington, once again, also called the AFLS. That's going to measure for me basic living skills, home skills, and community participation. It's designed for all ages. Or perhaps I'll use the Scales of Independent Behavior. And that one will measure adaptive skills and problem behavior. And I can use that one for the full lifespan. Individuals newly born to the gerontology, geriatric population, 80 years and above. Now, let's say I'm interested in doing a functional behavior assessment. I have a number of options here as well. I could use the behavioral assessment system for children, or I could swing over here and use the motivation assessment scale. So once again, the implication is that the assessment tool that I select will be based on some critical information that I'll have available to me, including the age of the person, the developmental level of the person, and the reason the person was referred to me. My point here is that a good clinician will have a matrix. A good clinician will make the selection from the matrix and determine which assessment tool best matches the needs of the individual and the circumstances that are presenting themselves. Regarding the desired outcomes of an assessment, I do want to make reference to a great article by Gould and colleagues, published in 2011 in the Journal of Research in Autism Spectrum Disorder. One of the things I've mentioned before in one of the previous modules is that one of your responsibilities as a registered behavior technician will be to advance your own knowledge and your own reading, for example. So from time to time, I'm going to point out these journals and these publications because that contributes to your effort to really develop your own skills as a registered behavior technician. But Gould and colleagues make a number of really great points regarding assessment. The first is that assessment should be comprehensive. So it should really look at all the skills that matter and evaluate all the skills that matter in terms of the person's development and quality of life. The other thing that a good assessment tool should do is to have precision targets. So for example, if the assessment is being used to measure a child's early development, then that would be the target of the assessment. That's what the assessment will focus on. And from a developmental standpoint, the assessment will give you information in terms of where that individual is falling regarding their own personal development. The other thing a good assessment will do is to put an emphasis on the function of behavior and not the form of behavior. This is something that we're going to discuss in depth in one of the subsequent modules, but we want to make sure that that we're addressing skills that will serve a function and an important role in the individual's life. The other thing a good assessment will do is provide a linkage between the assessment and curricula targets. So we want to make sure that whatever goals and objectives that we've identified for an individual are essentially linked up to the assessment that was conducted, because that's what gives logic to what we've selected in terms of goals and objectives. That if we know through an assessment tool and as a result of assessment results that there's a specific deficit, for example, then that logically connects us to very specific goals and objectives. And one of the things that will be important for you as a registered behavior technician is that you will serve as a very important link between the two. You'll have a sense of the assessment results because your board certified behavior analyst will review them with you, or somebody from another professional category like a speech and language pathologist will review them with you. And then you will link the assessment tool and the assessment results to the programming that's been designed. And you're the person that pulls the two together, and we rely on you as an interventionist to actually make a difference in an individual's life. The other thing that you should be aware of, and we've discussed this previously, and that is behavioral intervention technologies. There are a number of great systems out there, and I make reference to Central Reach as being one of them. A lot of great systems where in the software itself, you're able to record what assessment tool had been used, what the assessment findings were, and then to cross-reference that to the goals and objectives that have been delineated for an individual. Now, finally, the other thing that a good assessment should do is it should be useful to you for tracking purposes and for monitoring the individual. So that's what we're looking for in terms of a good assessment tool. And Gould and colleagues did a great article on this very topic. Now, the undesired result of an assessment. These are things that we don't want. I always like giving the example of what we do want and then the non-example. So the undesired result is for us to be advancing in an unbalanced way, to put an overemphasis on some skill area without considering other important areas in a person's development. The other thing that we want to avoid is non-individualized programming. So we do not want generic programming. We do not want a clinician just gathering up goals and objectives that they found in some location and assigning them to an individual for the purpose of developing a program or having a program in place. That would be non-individualized. It would be not connected to assessment. It would not have logic or rhyme or reason in terms of why those goals and objectives are being identified for a person. So those are things that we do not want. The other thing that we do not want in terms of programming is a focus on unnecessary and non-functional skills. So that also happens if assessment's not done. If a clinician, for example, just gathers goals and objectives and puts programs in place that are disconnected from the individual, not related to assessment of the individual, then we can find ourselves doing things with the person that seem to have no function, that has no capacity to advance the person's quality of life, that has no meaning for the person or the person's family. These are all things that we do not want. These are undesired outcomes. Unbalanced emphasis on skills, non-individualized programming without focus in terms of what is important, but rather more of a focus on the unnecessary and non-functional. So, from an ethical standpoint, if that's what you find yourself doing, any of these things in this category, that's the time for you to raise that red flag and maintain the ethics and preserve the reputation of the field of behavior analysis and to have a voice in terms of what is right and what should be done with an individual. So I just made another connection here to the ethics training that you've been through already. So once again, I've got some examples here in terms of various types of assessment tools that could be used. So for example, if we're working with a person in a community, we may use a community-based skills assessment. If we're working with an individual that's perhaps newly diagnosed or in the early years of development, maybe we'll use the VB-MAP. If we're working with an individual and we're really focusing on their daily living skills, we may use the assessment of functional living skills, the AFLs. If it's social behavior that we're looking at and we're working with a person in the context of a school, perhaps it's a school social behavior scales. And then if we're working with a family and we're trying to develop their skills, and I'll talk more about this in a little bit, we may use everyday parenting as an assessment tool. And then finally, perhaps we'll use the Vineland as an assessment tool if we're working with individuals and trying to get a sense of their comprehensive presentation. So all sorts of options in terms of assessment, and the clinician that you're working with will certainly make the best recommendation in terms of what assessment tool to be used. Now, with respect to the outcome of the assessment, just a little bit of time needs to be spent on this concept. I've already introduced the term behavioral cusp, and that has implications for us because once an assessment is completed, we need to make a priority list in terms of what we will focus on, what our goals and objectives are. And I just want to remind you that the definition of a behavioral cusp, it requires us to prioritize changes that first result in access to new reinforcers, contingencies, and environments. So we're going to develop skills that allows a person to do just that. So to access new reinforcers, perhaps we're focusing on language skills, communication skills. To access new environments, perhaps we're really focusing on behavioral regulation. For example, one of the things I mentioned in terms of the assessment discussion was working with a 17-year-old with obsessive compulsive disorder. The OCD would prohibit the person from going into many environments. But if I've made gains with that individual and have stabilized that person, then I'm giving them access to new environments. So we need to prioritize changes that result in that. Access to new reinforcers, contingencies, and environments. We also need to prioritize goals and objectives that meet the demands of the social community of which the learner is a member. So if the person's in a school-based context, then that person's changes, their performance, their behavioral shifts needs to meet the demands of the social community. So therefore, I may be focusing on academic skills of the person, or I may be focusing on the social skills of the person, or the person's capacity for behavioral regulation. Third thing regarding the behavioral cusp is that what we focus on needs to facilitate subsequent learning by being either a prerequisite or a component of more complex responses. So essentially, I want to build the person's skill capacity. And as a result of building their skills, it gives rise to learning even more complex behaviors. So all of our focus needs to be on incrementally developing the individual's capacity to present themselves in a more and more skillful way. And then finally, with respect to a behavioral cusp, we need to really focus on skill development that results in the replacement of inappropriate behaviors, and doing so in such a way that it benefits all the stakeholders. What stakeholders? Well, it could be the classroom community, it could be the family, it could be mom and dad, it could be siblings. It benefits all the individuals. And once again, I just want to point out to you, the professional literature base. This is an excellent article. It's called Behavioral Cusps, a model for selecting target behaviors, by Bosch and Fuqua, and out of Western Michigan University, published in 2001 in the Journal of Applied Behavioral Analysis. So everything that I just get done explaining to you here is outlined in that article. So the major point, once again, is that once we've completed an assessment, we have to select the skills and target behaviors that we'll be focusing on. And the way we do that is by holding the targets and the goals and objectives that we developed against the standards of a behavioral cusp. The other thing I want to point out is what's referred to as pivotal response training. And pivotal response training was developed out of University of California, Santa Barbara, at the Kagel Autism Research Center, by two educational psychologists, Dr. Lynn Kern Kagel and Dr. Bob Kagel. Pivotal response training involves a focus on what's referred to as pivotal areas of child development. So once again, we have assessment results and we're asking the question, what should we focus on? And the answer here is that let's focus on what is pivotal, what will open doors for the individual, what will result in advances if the person acquires certain skills and abilities. What skills and abilities? Well, we need to tap into the person's motivation initially. So if we can get a sense of what motivates an individual, then that becomes pivotal in terms of teaching the individual and getting them to advance with their own with respect to their own skills and abilities. That's why in the previous module we spent so much time on talking about preference assessment and also reinforcer assessment, because if you're going to motivate the person, then you have to have selected the appropriate reinforcers that are arranged as a result of that person's appropriate and correct responding. The other thing that will be focused on in pivotal response training is the person's capacity to respond to multiple cues. There's also a focus on the individual's capacity for self-management. This makes a connection to self-determination, self-efficacy, and independence. And if we are doing the best we can do for an individual, then that will mean us preparing that person to be as independent as possible, not relying on us, not relying on you as a registered behavior technician. When we've really made inroads and we've made gains with the person, then the outcome is that person's independence. And that's what we are always striving for. And I'll make a connection back to one of the previous modules as well on normalization by Wolf Wolfensberger, if you recall. We want to normalize the person's life to the greatest extent possible. And one way of doing that is by getting them to be independent. And then finally, we really focus on the initiation of social interactions. So the outcomes that we're looking for in pivotal response training is broad improvements across social ability, communication, behavior, and academics and academic skills. And these are the outcomes that we're looking for. So any good assessment that is conducted will provide information. It'll be a road sign. It'll point you to the appropriate direction in terms of what we need to focus on in terms of skills to build in the individual. And then we need to prioritize those things that meet the definition of a behavioral cusp, or those things that meet the definition of pivotal response training, that becomes our focal point, because we want to put our resources and energy toward what is going to be most meaningful for an individual. So we prioritize what is important to the person. And then, in brief, we're evaluating progress. We're evaluating a family's ability to support their child. We're evaluating the progress of perhaps a person with multiple disabilities. We're evaluating the person's progress at many different levels. So, in short, that's what we're trying to accomplish with respect to good assessment. Now, with respect to the details of skill assessment, I want to review for you the various different types of assessment. One form of assessment that your board certified behavior analyst supervisor will use is what's referred to as criterion reference. All that means is that the assessment is designed to measure student performance against a fixed set of predetermined criteria or learning standards. So by way of example, if there are particular skills that need to be acquired in order to demonstrate competency in some area, then a criterion reference assessment will evaluate where that person stands with respect to those skills and show you where the strength areas are and also where the deficit areas are. So your responsibility and the clinician's responsibility at that point will be to address the deficit areas so that person can get at criterion level of performance. For anybody that's here, for example, that may be a competitive swimmer or a tennis player, or perhaps you're a runner or a dancer, there are criterion performances that need to be met. There could be a criterion performance in dance. There could be a criterion performance with respect to playing tennis, and you can take any individual and evaluate them to find out where they are in relationship to that criterion performance, and then your work after that evaluation will be to address those deficit areas. When we do that, we refer to it as a criterion referenced assessment. Now, the VB map, which we've talked about pretty extensively already throughout the modules, is a type of criterion referenced assessment. Another one is referred to as the Brigance, Early Childhood Developmental Inventory. That is a criterion referenced assessment. So you're constantly evaluating the person against these standards, predetermined criteria, and learning standards, and you're looking to make a determination as to where the individual is in relationship to those standards. And once again, as I mentioned, assessment is a dynamic process, so we're constantly repeating the assessment process to make a determination as to whether or not we've made any progress or not. Another type of assessment is what's referred to as norm referenced, and this provides an estimate of the position of the person tested in a predefined population. So how does this individual compare to other individuals who are the same age? So if I'm working with a 6-year-old and I evaluate that 6-year-old child, how does that individual compare to other 6-year-olds, perhaps typically developing 6-year-old children? And I'll get a good indication of where my individual is from a comparison standpoint. A couple of good examples of norm referenced assessments include the Vineland Adaptive Behavior Scales, and also the Peabody Picture Vocabulary Test, PBVT test, that's often used for individuals to evaluate their language skills and language abilities. So those are referred to as norm referenced assessments. So the individual at the end of the assessment is being compared to a predetermined population to see where they stand in relationship to that population. Another kind of system, measurement system, and assessment system that's used is referred to as curriculum-based measurement. And this is a method that teachers use to assess how students are progressing in basic academic areas such as math or reading, writing, or spelling. So essentially what the teacher will do is take a look. This would be a time sample, for example. The teacher would be looking at the number of words that are read within a 5-minute time sample. So the intention of doing this is to bring the person to fluency. Perhaps that is what this teacher is trying to achieve, is a fluent reading behavior, and reading and decoding words rapidly, doing it with accuracy, and doing it faster and faster. So the teacher, for example, may acquire some baseline level right here for Kyle, and may find that that he's reading about 20 words maybe per per minute, for example, or during a 5-minute interval, or 30 words, and the high point over here was about 40. And then that teacher puts their interventions in place and takes a look at the post measure. So how did Kyle do with respect to reading during this 5-minute time sample? And he's gone from a low of 15 to a high over here of about 45. So here's the trajectory line in terms of the trend line that Kyle's following, and the teacher will do this kind of evaluation on an ongoing basis. And the reason for that is that the teacher wants to make a determination as to how the child is progressing in areas such as math, reading, writing, and spelling. So we have 3 forms so far. We've got the criterion reference assessment, we've got norm reference assessments, and we also have curriculum-based assessment. The next kind of assessment that is used is what's referred to as an ipsative assessment. And all that means is an assessment process that involves a repeat and a comparison of scores as a result of the replication. So one ipsative assessment type is referred to as the real-life rating scale. This is an assessment used to assess the effects on treatment on 47 behaviors, falling into the category of motor skills, social skills, affective skills, language skills, and sensory domains, and it's used for children with autism spectrum disorder. So in an ipsative assessment, the initial baseline is taken, interventions are put in place as a result of being informed in terms of what the person's deficit areas are, and then the assessment tool is repeated again and again and again in order to make a determination as to whether or not the person is making progress. And when we use that style and that methodology, it's referred to as ipsative assessment, the assessment process. Now, of course, from an assessment standpoint, one of the other things that we need to do is ensure that we are addressing the challenging behaviors, for example, that may be interfering with the person's learning process. So from an assessment standpoint, we need to make a determination as to what the reasons are, the causes are for the aberrant behavior that may be interfering with learning. And for that reason, we conduct what's referred to as a functional behavior assessment, and we're looking to identify the potential causes of behavior and the function of the behavior that's being presented. We're looking to identify skill deficit areas and performance deficit areas as well. So in a functional behavior assessment, we essentially are focused on a comprehensive and individualized process for identifying the purpose or function of problem behavior. And then we develop and implement a plan to modify the behavior, and that takes into consideration biological setting events, the social environment, and the immediate environment and context in which the person's behaving. And we're trying to identify the variables that are responsible for maintaining problem behavior, and then we put interventions in place to correct that. So the FBA goes hand in glove with the skills assessment, because you know as well as I do that many times we cannot teach new skills unless we're addressing things that are barriers to learning and addressing things that are competing with learning. And many times those things are maladaptive behaviors or aberrant behaviors. So in addition to the skills assessment, we may be conducting a functional behavior assessment with the individual. Now, another assessment that may be used at the same time, and one of the things that I want to make clear, that if a person is going to develop, it doesn't matter what presentation the individual has. Perhaps it's a person with autism spectrum disorder, maybe it's a person with a psychiatric disturbance. The professionals in the individual's life, you as a registered behavior technician, me as a board certified behavior analyst, or my colleague as a speech and language pathologist or occupational therapist or physical therapist, all of these people, you included, will come into individuals' lives and they will leave the lives of individuals. It is the family that remains as the constant. It is the family that is the lifelong shepherd of change and development and progress. And it's a lifelong responsibility for a family. It is the family that makes the difference in the individual's life. For that reason, on a simultaneous track, while we're focusing on the child's skills or the adolescent or adult, on a simultaneous track, we need to be focused on the family's capabilities and the family's ability to work effectively and to support effectively an individual, and for the family to function as a kind of interventionist as well. So for that reason, we also want to do assessments on families. And one of the things that we can use is what's referred to as the Keys to Interactive Parenting Scale. It's referred to as the KIPS, KIPS. And this will give us a sense in terms of where a family is regarding their critical skills, where their strength areas are, and also perhaps where their deficit areas are. Because while we're working with the individual, we can also be working with the family, getting that family empowered, getting that family equipped, getting that family made competent and capable in terms of guiding the life of an individual with some form of disability or psychiatric diagnosis, for example. And that doesn't mean that the family is not skilled or talented in many different ways. It just means that there are particular skills, knowledge, and abilities that need to be intact in order to guide the life of an individual that has some form of disability. And many times those skills, that knowledge, and those abilities are not just immediately present in the lives of individuals. It's not there for families. So therefore, for us as professionals, one large part of our responsibility is to guide the family, to build their skills, and to empower them and to equip them to function as an effective guide and shepherd for the individuals that they for that person they care very much about, and that be their family member. So the KIPS is one form of assessment that can be used. There's also what's referred to as the Family Assessment Interview, the Family Adaptability and Cohesion Evaluation Scales, the Family Environmental Scale. These are just some of the assessment tools that can be used with families in order to prepare them for their role as an interventionist. Another kind of assessment I want to refer to is what's referred to as a standardized video assessment. Video evaluation allows us to capture an individual and to record their personal presentation, and to do that with video, and that yields a permanent product. Some of the very exciting work is being done by Dr. Dennis Wall, Associate Professor of Pediatrics out of Stanford University School of Medicine. He's using video for the purpose of capturing the skills and abilities of young children with autism spectrum disorder, and using video for the purpose of evaluation and assessment purposes. So if you have the opportunity to look at his work, it's very exciting, very innovative, and progressive, and it integrates and relies highly on standardized video assessment. Now, once we have all of our assessments completed, once we have our goals and our objectives, everything's prioritized. We know that we're focusing on what's meaningful. It's meeting the definition of a behavioral cusp, or they're pivotal behaviors that are going to make a difference in the individual's life. Once the team has agreed that this is a direction that we need to go, then all the goals and objectives are mapped out for the individual, and we're in a prime position at this point to begin intervening with good strategies and good interventions for the person, all of which your board certified behavioral analyst will design. Now, your role here is in the execution of the interventions, and that is a critically important role. Once again, I mentioned that you are the link. You're the linkage between the assessment, and you're the link between that and the interventions, and you are right in the middle there. So we really rely on your competence, your motivation, your interest, and all of your good skills to help guide an individual's life. Whose life? Well, that person who you're serving. You'll be the person that is instrumental in terms of making change in that person's life. And then at that point, we are ready to launch in terms of our work. And just a few things that I want to point out here is that you know what the skills are that we'll be focusing on. And one of the things that I should mention is that with respect to the development of goals and objectives, the VB map, which we've talked pretty extensively about already, has a bank of goals and objectives that can be used. So the clinician that's designing the intervention and designing the programming for the child that you're working with does have a resource there. And that resource is a bank of goals and objectives that are readily available in the context of the VB map, and the goals and objectives that the person selects will depend on the needs of the individual, and that will be based on the assessment results, of course. Now, the assessment will also give us a good understanding of where we need to begin in terms of the skills and where that person is leveled in terms of their ability. So we want to build off of that person's current strengths. So good assessment will allow us to do that as well. Now, the other thing that occurs as a result of having conducted an FBA, which goes hand in glove once again with skills assessment, is that through the FBA we're able to identify barriers that are things that are getting in the way of learning, things that are getting in the way of progress. So as a result, we have, along with our skill intervention programs, our skill building programs, we have our behavior intervention plan. And that has been designed and will be designed for you for the purpose of addressing the aberrant behavior, the maladaptive behavior that may be interfering with individuals' progress. The next thing that will occur, and your BCBA supervisor will do this, is that he or she will identify the specific teaching strategies that will be used. Now, I'm going to remind you, once again, I'm going to make a linkage back to the ethics component of the module so far. We're always using evidence-based practices. We're always using those things that have been verified and demonstrated to be effective with individuals from various disability groups, including autism spectrum disorder. So anything put in your hands, anything given to you in terms of an educational strategy, a strategy to build skills, or a strategy to address maladaptive behavior, should be an evidence-based practice. You should be able to find verification of the efficacy of that intervention, and that should be made available to you as your tool for guiding the individual's progress. Now, a couple of things I want to mention here in terms of teaching strategies. One of the things that is now available to us as professionals is an entire bank of good programs that have been developed by other people in the field. So we live currently in this community that is well networked through technology, and as a result of that technological connection with other people, we have many individuals who are contributing to a data bank, and that contribution includes good programs that they've used, that they've developed for individuals perhaps with a similar profile. So you can go to places like the Central Reach Marketplace and pull programs right from there and use them potentially if it fits. If there's a goodness of fit between what you found in the marketplace and the individual that you're working with, then that really saves the clinician from generating something from scratch and putting a lot of resources and time into something that's already been developed, for example. So the Central Reach Marketplace is a great example of one resource that is available. The other thing I want to point out is another kind of marketplace, and it's called Teachers Pay Teachers. And this is an open marketplace for educators where they too make contributions in terms of programs and teaching methods and lesson plans, for example, that can be used by teachers, can be used by clinicians, can be used by registered behavior technicians for the purpose of teaching skills. So we live in a global community. We live in a well-networked community as a result of the technology that's available to us today, and cloud-based systems of storage and our ability to access files and data banks as a result of people contributing from all over the world. So let's take advantage of that global community and use the good thinking and the good programs and the good lesson plans that have been developed, and potentially, if there's a goodness of fit, bring those things and into the overall system for the individual that you're working with. Of course, your board certified behavioral analyst will have complete control over that in terms of what is used and what is not used. But I just want to make you aware of all the resources that are available. And then finally, one of the things that will always be considered is the best context for working with an individual. What kind of educational setting, or what kind of vocational setting, or what kind of community-based setting is most appropriate. So context is everything. And once again, your board-certified behavioral analyst will make some determinations with respect to that as well. Now, in conclusion, similar to what we always do, some questions and answers. The first question is an assessment method designed to measure student performance against a fixed set of predetermined criteria. That's a criterion reference assessment. An assessment that provides an estimate of the position of the test individual in a predetermined population. There we have norm referenced. A method that teaches use to assess how students are, teachers use to assess how students are progressing. That's a curriculum-based assessment. An assessment designed to identify potential causes of behavior. Well, that's our FBA, our functional behavior assessment. And then finally, assessment that involves a comparison of scores over time. This is what's referred to as an ipsative assessment. And that is our overview of assessment methodologies, and with a particular focus on using diverse measures, diverse assessments for the benefit of an individual. And that, again, going hand in glove with the FBA, which is designed to identify the most appropriate interventions to manage those things that are interfering with learning. So once again, I'm going to remind you of the recommendation to ask your BCBA supervisor to explain to you the assessment tools that they used, to rehearse using some of those tools, and to ultimately demonstrate your performance. Thank you for your attention, and I will see you in the next module.